Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral, fully occluding, really soft, wet type of earwax. I would classify this earwax as being a type 5 stroke type 6 type of earwax based on the newly developed Rye modified Ceremon chart, which is based on the world famous Bristol stool chart. So earwax traditionally is classified as either being wet or dry, but there are many subcategories of wet and dry. So I think early last week, I uploaded a caption of the different types of earwax and a description beside of it, each of those. And so your type 1 type of earwax is your really dry, hard earwax. So that's got an extremely high keratin content, so dry, dead skin, when compared to lipid content. So earwax is made up of dry matter, which is your dead skin cells, corneocytes. These are the skin cells that live on the surface of your ear canal. And as they shed, they form into earwax alongside the wet matter. So sebum, which is an oily lipid secretion, also found on our scalp and all across the body, actually. And then the emotional sweat that we secrete in our ear, produced by the ceremonous glands, which are modified apocrine glands. So they differ from your normal ecrine sweat glands that try to cool your body down after exercise, for example. The sweat produced in your ear is an emotional sweat in response to a heightened emotional response, so anger, fear, stress, pain. So most typically as a result of the fight and flight reflex, or indeed sexual arousal. So that's your wet matter. So a type 1 is when you've got much higher consistency of dry matter, probably say 90% in comparison to 10% lipid matter. On the other end of the scale, you've got your really loose, runny, wet, almost liquid state wax, which is, I would say, 90% lipid, if not more, and 10% dry matter. So typically, earwax is 60% dry skin, 40% wet matter. So based on that chart, I would base this as, I would say definitely type 5 to type 6. So it's wet earwax. It's not completely loose and liquid state. And at the end, I'm going to show a still image where you see the wax on a tissue. And when you compare it against the table and the graphics I produced last week to differentiate the different types of wax, the best description is soft blobs, but with clear-cut edges. And you'll see that in the still image at the end. So a type 6 would be when the edges are quite mushy. So they come out in small blobs, but type 5 is when they're clear-cut edges, and the type 6 is when it's mushy, so it's rough around the edges. So the reason I'm saying between a 5 and 6 because the pieces on the tissue resemble the type 5, but obviously I vacuumed a lot of it up as well, so that's more the mushier stuff. I've also developed a grading system based on how occluding the earwax is. So the grading system is purely on how much of the view of the eardrum is obstructed by the earwax, as opposed to symptoms. And the reason why I say that is you can get a patient with just a little bit of earwax, which I assume is not going to cause the patient any symptoms, but they really, really feel the earwax is affecting them. Well, not feel, it is, because they wouldn't be there otherwise. And conversely, you can get someone with a huge amount of earwax and you can't see anything, it's completely blocked the ear canal, but the patient doesn't notice any symptoms. So with the grading system, I haven't done it based on symptoms because it's impossible to do that. So I've done it on how much it includes the view. So there's 5 grades, but the first one I've named it a grade 0. So grade 0 is when you've got natural surface coating wax, so it's non-occluding. We all produce wax. So and wax is healthy, so I don't want to classify healthy wax on this grading system. So but obviously we do have to acknowledge it. So I've labelled that a grade 0, and I think that's a good way of labelling healthy earwax. So I would classify grade 0 earwax as a less than 25% occluding view of the eardrum. Then you've got your grade 1. Now, I'll come back to that in a moment. I'm just getting this patient to do the Valsalva because they felt bit of negative middle ear pressure, and I think you may see it, I'm not sure, but the eardrum did inflate. So we forced air up the eustachian tube via the nose, and it increased the air pressure in the middle ear, which then caused in this case the pars flaccida, the top part of the eardrum, to slightly inflate. So we just wanted to check the eustachian tube was patent, it wasn't obstructed. So grade 0 is less than 25%. There we are. We've probably just seen that inflate. So grade 0 is normal healthy wax, where the view of the eardrum is not compromised. Grade 1 is when you've got approximately 25% occlusion. So you can still see the eardrum. You may have to manipulate the endoscope to visualize the full eardrum, or if you're using a speculi, sometimes you can use a speculi to push through some of the partially occluding wax. So yeah, we'll call that partially occluding earwax. So around 25%. And that can even just be a thin sheet. So the ear canal is approximately 2.5 centimeters. So again, you can get an ear canal full right from the entrance to the eardrum, or you can just get a thin sheet of skin, less than 0.1 millimeters in thickness, blocking the whole ear canal, and you'll have the same effect. So sometimes it's not even quantity of wax and how much it fills the ear canal that causes symptoms. You can have the smallest amount of a thinner sheet, and it'll still have the same impact. Grade 2 is approximately 50%. So we call that semi-occluding. So you can normally see half the eardrum. Your grade 3 is 3/4 occluding. So you're just seeing some of this. It's not fully occluding. There's some sound still getting through, and you can just about see some of the eardrum. So I would say this ear, when I started, was a grade 3. And last but not least, grade 4 is when the eardrum is not visible. And so that would say grade 4 was the left side. Now, why are these grading systems important? Now, we get grading systems in all other parts of ears, so in terms of a cholesteatoma grading system, your carotis obturans. You even get grading systems in terms of retractions of the pars flaccida and also the pars tensa. So grading systems are used all across not only audiology and otology, but other healthcare disciplines. And it really helps when you're especially communicating with other colleagues, and also for my own notes. So previously I was having to type, because obviously after each patient I document what we've done. And so previously I would write patient attended with 3/4 occluding earwax that was wet, loose, mushy in consistency, and kept blocking the tube, just to kind of highlight for future reference what type of wax they have. And here I can easily write patient attended right here, I think I said grade 3, type 6 earwax, or whatever type it was. Left ear, grade 4, type 5 earwax. That has, I'm already introducing it into my own clinical notes, and it's made a big difference. Not only is the notes more succinct, it's more precise, it's easier for me to type my notes, and when I'm in the future reading these, the patient comes back, hopefully, and hopefully in the sense where, not that they're going to suffer from earwax problems again, but if they do, that I've done a good enough job that they feel comfortable coming back. When I revisit the notes, it's very easy for me to kind of remember or remind myself of the patient's condition last time. So, and it's again, it's just type 1 and so you've got a grading system and a type, and I think it's going to work really well. So I would say the wax plug in this size, you saw as a big plug came out there, that was more of a type 3. So it came out in blobs. If it was a long singular piece, I would classify as a type 4. I will upload the grading system. I don't have it at the moment, so I've modified the last one I did. I've just improved I've provided some better images, but I will upload it in the next few days. So keep an eye out for that. So we're just mopping up around the edge, just some dead skin keratin here. Obviously I put a bit of oil, so I'm just going to dry up the entrance. The patient is really pleased. So I'm just using the fine end here. And in a moment you will see some still images, and they're going to pop up now. So when I'm cross-referencing it to my my table is definitely type 5 this. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.